From my point of view, where I'm working at the moment, I work in a resource limited setting where access to diagnostics and treatment and vaccination is not as it should be and not as I would like it to be. So the next big thing in the field should be the provision of cost-effective diagnostics, access to universal treatment, and access to universal vaccination. This is for hepatitis B infection, which is what I'm studying. The other thing that I think will be a big thing, particularly in Africa, is introduction of hepatitis B birth dose vaccine. So at the moment, the WHO advocates birth dose vaccine worldwide, but in many African countries, it's not implemented, which leaves babies at risk of being infected with hepatitis B until they're about 6 weeks old when they get their first vaccine. And so it exposes an infant to a lifelong chronic infection from which there's significant risks of cancer, liver cirrhosis, and onward transmission. So the day that Hep B birth dose is rolled out more widely will be a huge event in the hepatitis B world. And then finally, along with sort of the public health interventions, there's a lot of cool science that's going on with hepatitis B research at the moment. Hepatitis B is a virus that cannot be cured. It's the treatment that we have keeps it at bay and stops it replicating, but it forms a mini chromosome inside liver cells. So it's got a little circle of DNA that stays there forever, and it also integrates into the human genome. And nothing that we do at the moment disrupts those or gets rid of them. So if you ever stop treatment, there's a significant risk of having a flare of that virus. And there's lots of cool stuff looking at disrupting that genome, disrupting that sort of DNA inside hepatocytes through different mechanisms. I think we're still quite a long way off being able to even take that into human clinical trials. But Hep B cure would be definitely the next massive thing in the hepatitis B world. And I hope that I'll still be doing research when that happens, because that will be absolutely groundbreaking.